Now, let's talk about some issues that has to do with a person who go and buy a drug over the counter, even though it should have been prescription drugs, then buy, for instance, a pregnant woman. Some people buy some multivitamins and then they still take the one from antenatal that that were given, not knowing that this could also contain, for instance, folic acid. You take another one containing, I'm just giving that as an example. That's mixing drugs, not bearing in mind that they could have the same components or properties, and then overdosing coming into play there.
Yeah, thank you very much. That's a very important question. When it comes to pregnancy, I mean, the rule of thumb is that you shouldn't take any medication that is not prescribed by your doctor when it comes to pregnancy. So it's advised that pregnant women shouldn't just go out there to buy supplements, even if they think, oh, this is a pregnancy supplement. They should always take, if they feel they need to take a supplement, they should always ask an advice from their doctors before starting that supplement. Because we have a lot of drugs that, even if they are OTC, like you said, folic acid, iron, maybe calcium, if they are taken in certain quantities, it can affect the new child, the baby in the womb. So mothers should be very careful when it comes to taking drugs that are not prescribed. And even if they feel they need to take it, they have to consult their doctors. And again, one of the things that we should understand is that whenever you are on any drug, you should always ask your pharmacist or doctor about how best to use that drug, and always let them know the kind of drugs you are taking.
Yeah, because before a new one is given.
Yeah, because before a new one is prescribed, because we have what we call drug-drug interactions. You might be taking an OTC drug, an over-the-counter drug, and you think it's safe, and you go to the doctor and it prescribes another medication for you. Taking those two drugs, there might be an interaction which can prevent one of them. It can lead to one of them being ineffective, or it could even lead to one leading to an accumulation of one in the system. So you should always ask the advice of your pharmacist or doctor whenever you want to take a medication.
Talking about drug reaction, I think there's drug food reaction too.
Yes,
because I think there's some certain drugs that you shouldn't take with orange or with milk or things like that. Let's talk about some of them.
Oh yeah, commonly anti-malarials. Now what we call the artemisinin combination therapy, ACT, commonly should not be taken with anything with orange, anything orange or that has vitamin C. Because what that does is that it destroys the drug itself and it makes it less active. So what happens is that you take an anti-malaria, you take maybe food that contains orange.
Some of those anti-malarials are bitter, so somebody just want to use this orange juice to push it down or something like that.
Yeah, but really,
it has
it shouldn't be taken. Yes, it shouldn't be taken. It's vitamin C in the orange actually inactivates the active ingredient in the artemisinin combination therapy. So you shouldn't, even most doctors, when you go to the hospital, they always advise you, don't take this drug with anything containing vitamin C, don't take it with anything containing iron, because such food items or other drugs actually inactivate. And what happens is that you now have a lower dose of the anti-malaria and in the system. And what happens is that the Plasmodium falciparum parasite is not cleared, so you have treatment failure
because the drug is not strong enough to fight.
Yeah, because something has broken down the drug, which is the vitamin C in the orange. So it often happens to children, I must say, because children, the mothers want to give them, even a drink like Fanta can inactivate the active ingredient. Yes, soft drink like Fanta or
no, we don't have to mention.
Okay, soft drinks can inactivate the active ingredient in those anti-malaria. So you see a lot of children, they experience treatment failure with the treatment of malaria. And you find out that after about a month, they are down with malaria again, and they have to be given another dose of the anti-malaria.
Perhaps it's not just because maybe the drug is the substandard, but because
they're not taking properly.
Yeah. While we're at this, some people, because the tablet is bitter, they wrap it in solid food. What does this do?
Yeah, really, that doesn't do much. It doesn't really, it only
slow down.
It just a little bit. It just slows down the absorption, because what that means is that the food you've used to wrap the tablet has to be dissolved before
it gets to the...
Yes, it actually just slows the absorption of the drug a little, maybe for some minutes or so, but otherwise it doesn't affect the activity of the drug.
Okay, what about using liquid other than water? We've mentioned juice. Which other one should we avoid taking our drugs with?
Yeah, for some drugs, milk. We have some drugs that react with milk. So when you are taking such drugs, you have to stop taking milk. There are other foods that also affect drugs. So, I mean, by the time you get a particular medication, your pharmacist, at the point of dispensing the drug, should be able to advise you on the kind of interaction that can occur with that drug. And again, he's also meant to ask you every other medication you are taking, so that he will advise you properly. Then on your own, like I will encourage everybody to be very involved when it comes to safety and drug use, because we all need to take responsibility for ensuring that we use drugs safely. So when we are actually seeing our physicians, our doctors, our pharmacists, we should ask them as many questions as possible, because that helps to prompt them to also let you know things you should avoid and the right time to take medications. Let me give you an example. As simple as missing maybe your dosage by as much as 30 minutes when it comes to drugs like antibiotics affects the outcome of that treatment. So if you are meant to take an antibiotic by 12 p.m. and you take it at 12:30, you find out that the efficacy of that drug has reduced a little bit, and perhaps you won't get the required treatment which that drug was meant to. So we should all take responsibility and to ensure that we take drugs safely, and we ensure that we get the maximum benefits from those drugs.
I think it's instructive that you said we should ask as many questions as we can when we see our doctors or pharmacists, because sometimes, you know, because of perhaps the number of people waiting to see the doctor, you just rush in, then you rush out, and then you go to the pharmacy, the pharmacist just writes 111 and then you go. So but we all need to know, whether you're a pharmacist or a doctor, know that we should explain these things to the patients.
Yes, definitely we should. And the patients should also ensure that they ask questions too, especially when it comes to children. Mothers should be more proactive in ensuring that they ask as many questions from their healthcare providers as possible, to how best to give their medication and how to ensure those medications are kept safe in the home, so that the children will not come in contact with them and use them.
Okay, we'll just take a quick break, and when we come back, we'll be talking more about you can use your drugs safely. Just stay with us on Health Matters.
Welcome